The American Lung Association presents spirometry testing in primary care. We'll be discussing air trapping. So air trapping typically occurs when a patient cannot fully exhale the air that's in their lungs. This is typically seen in patients that suffer from COPD, asthma, could be bronchiolitis or even bronchiectasis. The causes result in alveoli stretching or a loss of compliance of the alveoli. They become stretched out and don't bounce back to their original shape. This can also result in a compression of the capillaries and arterioles surrounding the alveoli. Can lead to increased lung volumes that inhibit airflow. Can also lead to decreased pulmonary blood flow and can also lead to heart disease. Typically, patients with air trapping would demonstrate symptoms of dyspnea. They would have a hard time getting a good deep breath in. They would become fatigued easily. They would have an exercise intolerance. And any physical activity could lead them to extreme dyspnea. And actually, over time, patient actually may even develop heart disease. And when we look at these symptoms, they could also be symptoms of many other diseases, including heart disease. Air trappings affect mainly the small airways. The implications are present in both asthma and COPD, particularly with repeated exacerbations. Obstruction of small airways occur through mucus impaction, reduced airway diameter from inflammatory infiltrates, smooth muscle hypertrophy, or airway wall thickening, or a combination of all of those. When we're looking at values, when we look at air trapping, we're looking at a functional residual capacity or a residual volume that's increased by greater than 120% of the patient's predicted. Hyperinflation will result in a total lung capacity being increased by more than 120% of predicted. If you suspect air trapping, you should refer the patient for a hospital-based pulmonary function lab so that plethysmography can be performed for lung volume testing. Additionally, a CAT scan should also be obtained for the patient. At the American Lung Association, our vision is a world free of lung disease.